Are you still hiding those legs because of your veins? Are those blue veins and red veins bugging you? Well, guess what? I have the answer for you. On today's episode, I have the vein guy, Dr. Yalamanchili. Yep, say that fast 3 times. Dr. Yalamanchili. And he's breaking down everything about vascularity and those legs that you try to hide. So check it out, where he spills the tea on everything leg beauty. All right, everybody, welcome to another episode of The Beauty Outlaw. And today, like I said in the intro, are you afraid to walk around with your legs showing? I was, and I'm not anymore. So I want to break this down for you with Dr. Yalamanchili. Can you please share with me a little bit about you first? Go back to where you grew up and kind of move forward from there. Let's dive deep into your background.
Wow. So I was born in India. Both of my parents are physicians, and when they first moved here, childcare was not easy to get, especially at the pay that they were paying residents. So I grew up in India with my grandparents for a few years before I moved here when I was 11. My mother's an OB-GYN and my father's an internal medicine physician. So, I've grown up with lots of doctors all around me. So it was an easier path to take. It was not an easy path to complete, but here we are. I went to medical school at University of Illinois, undergrad at Purdue, and my surgery residency was done at Trinity Healthcare, which is Mount Carmel Health in Columbus, Ohio. So after that, I started specializing in minimally invasive and robotic surgery. So I do a lot of minimally invasive foregut surgery.
Explain foregut.
Foregut is really anything from the mouth to the stomach. And the procedures that I specialized in were acid reflux surgeries, things called Nissen, where you wrap the stomach around the esophagus, minimally invasive, diaphragmatic hernia surgeries, and so on. And then, of course, I specialized in lower extremities, specifically venous disease. So unfortunately, today, it's very hard to be a master of many things because of the technology advancements in medicine. So you sort of have to pick the things that you want to do and specialize in them and become a master of those. So I've decided to do abdominal wall surgeries and venous disease.
Oh, so at your clinic, so tell us a little bit about where your clinic is.
Sure.
I know where it's at, but explain to everyone
Yeah,
where it's
I've
located.
actually, I have 2 locations. One is in Newport, which is where we specialize in veins, or venous diseases, I should say. And my other clinic is in Pomona, which we tend to handle patients with a little bit worse pathology, but also I perform a lot of general surgical procedures like the abdominal wall surgeries that I was talking to you about. However, in Newport, we tend to be very focused on the venous disorders.
Which I think is so cool. Now, something
Thanks.
else we're going to come back to this.
Sure.
But something that was really cool that you mentioned before we started, and that was a little bit about your work during COVID. Being one of the first, you got to share that because that's super cool.
That was, that was definitely
difficult time.
Difficult time, but it's funny because we actually shut down our clinic by the governor's orders on I think March 17th, if I remember, 2020.
You do.
So it was a pretty pivotal thing, but it was nice because we were working so hard in starting up the clinic in Newport that I just needed to take a breather. And, whether I wanted to or not, it was forced upon me. So it was quite nice. At that time, testing was very hard to come by. So you sort of had to assume somebody had it or not. We didn't even understand the containment procedures. And I believe one of the first patients that died in LA County from COVID was actually in Pomona Valley Hospital, which is where I operate. So I still remember to this day when we got a call about that patient. And unfortunately, the paramedics that worked on him and also the one of the ER staff members, I think, perished to COVID from acquiring it from that patient. That was like basically patient 0 in that area. But anyway, so our goal was to improve access to testing because that was the cornerstone of understanding what to do with that patient, whether it's a common cold or access to, or COVID. And the care was significantly different between the 2 patients because we were treating COVID patients with all of our knowledge present until then, and it wasn't working. So my wife and my brother-in-law, who's a PhD in virology, and they kind of got together and they said, hey, this is a simple test. It's a PCR test. So why can't we do, mass offer this using your expertise and our access? And there was no reason not to. And so we got together, bought a PCR machine. He drove it down. We worked with a lab locally and set up our first private, the very first lab in Orange County that was doing private testing for whoever wanted it. And this was PCR, the gold standard then, and it's gold standard today. We just started doing that. And then we, a few of the news programs picked us up and started talking about it. And then we started getting calls from the entertainment industry asking if we can help out with them, because that was, that's kind of the backbone for Los Angeles, right? Like our taxes and amount of employees and in general jobs that are related peripherally to the entertainment industry.
Yeah.
And next thing you know, we are, signing contracts with Amazon, MGM, Disney, Netflix, Hulu.
And you're going, oh my gosh, so much for my time off.
Yeah. So for 3 years straight, I mean, we were one of the main laboratories that served all of the entertainment industry. I don't even remember how many hundreds of thousands of tests we performed. I think they were saying something like almost, $2 billion addition to the job market through the testing that we did. So,
wow.
We were, in fact, the entertainment industry's first in COVID production happened.
So this was a go-to. Would you do that there?
We scaled up from about 5 employees to 500 in about 3 months.
I was just gonna say, you had to move that pretty fast.
we moved fast. And the thing is, for us, we wanted to, just like my practice, I want everything contained within our ecosystem, so that you can't point the fingers at some other third-party vendor as to if things went wrong.
Right.
So we said, not only do we need to do the testing, we need to own the laboratory doing the testing. We need to have the hired staff that would actually perform the swabbing. We need to have the transportation, and we need to have the software that publishes the results. So we built everything in-house. We had our own staff transporting the samples. We had our own software that we built from, zero to full-on software that delivered the results. And now it's still actually functional to this day to deliver other laboratory results. We just have to tweak it. And the staff all belong to, the company in terms of their employment. So there was no one else outside of that ecosystem that was necessary. And, that was one of the things the studios liked, is because they already are in quite a bit of an uphill battle getting things going. Mm-hmm. They did not want to deal with 4 or 5 people that can handle the testing and the results and, management. So we were the one-stop shop for them. And that's why we scaled from one show to, I think we did almost 1,400 productions over the course of the company.
Wow.
So if you saw any TV shows between 2020 or movies,
it was you guys doing the PCRs.
It was us in the background doing all of this testing. So it was a lot of fun time. I'm not sure if that's my cup of tea, the entertainment business, but I think, I've met some absolutely fantastic people. I mean, we went all the way up to the board of Disney. So it's interesting.
Well, and at that time, we were really so isolated to little pockets that you got really connected with the people you worked with.
Yep.
If you still got to work.
Yeah. And it was interesting because I was, from, I would say, the stock room to the CEO, as they say, right? So there was not a part of business that I wasn't aware of, that my brother-in-law and my wife were not aware of, because we had our finger on the pulse. And the directors from, each of the productions to the CEOs of these large companies, MGM, I had close relationship with all of these main members, because they'd call me at 2 a.m. asking about, can this thing happen? Can we actually do this? Or should we change our trajectory or direction of how we're doing things? And we traveled everywhere from, all over the country to Cabo to Europe to try to get a lot of these things managed and handled.
Wow, that's a really cool.
Yeah, it was definitely
story.
It's definitely a nice Christmas Thanksgiving dinner story to share with people. So it's a fun thing. Yeah.
Yeah, because now we define our lives truly through. Was that before COVID or after COVID?
Yep. It's basically our BC and
yes,
AD, right?
Absolutely.
Before COVID.
Absolutely.
Yeah. Absolutely.
Well, now that we know just a little bit about your your big life so far, and you're young. You're
Yep.
not exactly an old
young
man.
enough.
You're young enough. You're young enough. You got a lot more time. You liked vascular surgery or vascular
Specified to venous
yes.
disorders.
And
Yep.
these include many things other than what we're all thinking right now, right? Like you don't like your little blues and reds. That's
Yep.
different. And
Yep.
I'm going to let you explain the difference between those reds and blues, the one all you ladies don't like behind your knees and on the sides of your legs, and the bulging, and the ones that just flip and hurt.
So it's, it's interesting because this is something that is probably the most prevalent disorder present in Americans. They say something like 70 to 80% of people have venous disease. And this is, venous disease comes from various factors, the most important reason being genetics. So whether your mother, your father, sometimes maybe they're the lucky ones, your grandmother or grandfather may have had them, or you might be a de novo patient, meaning you might be the first one in your family that has this. So genetics, and unfortunately, a lot of our current work environment involves us to be static, right? Mm-hmm. Not a lot of movement. Even if you're standing or sitting, people don't tend to move much from those positions. And that has changed the way people suffer from these and the ages that they are suffering from these. Whereas before, it used to be something later on in the lifespan, but now younger patients are suffering from this. And I know we're in the age of Ozempic, and we'll see how that plays out. But weight gain has been a big factor in people acquiring venous disease. So all these put together, I tell people, really, if you want to discuss vein disease, it really just comes down to doorways that are not working. So your veins are working against gravity at all times, right? Whether you're sitting or standing, the only time they're really working with gravity, I guess, is when you're laying down and sleeping, because gravity works up and down, not sideways. And as the day goes on, your valves that are inside the veins, which is how the blood flows up and not back down, are working overtime, right? All day, your blood's trying to get back up to your heart against gravity. Something has to exist in the veins to make sure the blood doesn't fall back down. And these things are a system of valves. When those valves don't work, for all these different reasons I just discussed, what ends up happening is you end up having more blood down, because we all look like water towers, right? The highest pressure is in the bottom. And as the day progresses, the pressure builds up. It's called venous hypertension. So as the body accumulates this blood, its main goal is to decrease the pressure. It doesn't care how you look at the end. All it cares about is how much pressure it has or doesn't have. And the way it decreases that is by building more veins, trying to get the blood away from the veins that have failed. And eventually, those branches of branches find their way up to your skin, and that's what becomes visible. However, whether you see the veins on the skin or not does not determine whether you have vein disease or not, because venous reflux can happen without much visual understanding of under a vein disease underneath, and you could still have these symptoms from the vein disease. So the only way to diagnose it is with an ultrasound, which helps you understand whether the reflux is happening or not. So when you see that the blue veins or the red veins, the color really is not as important for us as it is to understand why you have them. You might be one of the lucky ones and you just have a few spider veins on the outside, and those can easily be treated with laser or sclerotherapy. But if you have internal disease, you have to go a few steps further. And back in the day, well, even sometimes today, the way these things used to be done are through a procedure called venous stripping. And it sounds as barbaric as as it is. The vein would be removed from your body through a series of incisions. You go down, find the vein, and you basically remove it from your body in hopes that it doesn't grow. Venous disease is stopped. However, as you can tell, with multiple incisions, removing something that's a blood vessel in your body, healing time was quite prolonged. People would have to take time off of work, sometimes several weeks, if not a few months. Post-procedure care was significant. And in fact, the hospital stay was anywhere between 3 days to 7 days. So it was a major intrusion into someone's life. And the question always is the cure worse than the disease? Because after this, some people would be worse off with all those incisions. Sometimes at the end of the area where you cut off the vein, it looks like Medusa's head because these veins are growing to heal the areas that you've cut, right? That's one of the ways that your body heals, by growing vessels to the area of the incision. So in the late 90s, they discovered maybe we don't need to do this much. Maybe we can put an IV into the vein, put a laser fiber through that vein, and just burn the inside of the vein and close it up. And that way we can do a minimally invasive procedure with minimal downtime, and then have the patient just continue on with their life. And of course, that's evolved over time. We've discovered better wavelengths that can shut off the vein with the reduced post-procedure effects. And here we are.
Here we are.
Yep. Here we are.
I'm one of his patients, and I didn't know I had valve disease. I really didn't.
Yeah.
And then one day it hit me back in August of last year. My leg, it didn't even get swollen. It just hurt. Yep. And I was like, okay, what's going on? I was afraid I had a DVT, the nurse in me. So I went right to that in my head. Knew that didn't happen. We actually have an ultrasound here. I knew that wasn't the case.
Great.
But I mean, I still wasn't sure. Researched, came across you, one of my patients sees you. And I went down, had the ultrasound, and to my surprise, I was a candidate.
Yeah.
I have the disease.
Yeah. And that's one of the things people don't realize, right? I mean, you don't typically look like somebody that might have this. I mean, I've treated marathon runners, I've treated athletes that are very muscular. And so unfortunately, you can't just look at a patient and say whether you have it or not. You have to go through the diagnostic studies, obviously interview the patient to see exactly what's going on. And people tend to, you would imagine that somebody that has vein disease, or with such prevalence in the country, they would just be diagnosed left and right. However, most people tend to live with pain, right? Most people tend to sort of grow into this thing thinking this is normal aging process, or a normal thing they've dealt with their entire lives, because they don't know to ask the right questions, or maybe they've gone to a physician that's not fully aware of what else is going on. A lot of the front doors, right, to healthcare are family practice doctors. They're dealing with A to Z of disease types. They have to be highly educated about every single type for them to know exactly what to do next. Whereas I'm a super specialist, which means that I only deal with a very small number of pathologies, so I can be really good at what I do, but it's really hard to expect our gatekeepers, which are family practice doctors, to know everything. And so I don't fault them that a lot of the patients that go to them that describe these symptoms may not get the care that they need immediately, because they just have so much on their plate. But those that do, and they see the right specialist, then you can diagnose them and actually help treat them for the rest of their lives.
And this is covered too. A lot of times the ultrasound, not all insurances, but a lot of people, especially if you're dealing with an older person, it should be covered for that ultrasound to check out and see maybe it's not neuropathy they're feeling altogether. Maybe it is this that can actually take and eliminate some of that pain.
Yeah, there are a lot of faults with American health systems, of course. There are a lot of roads we need to build better and give more people access. But at least the one thing is the diagnostic testing, thankfully, is covered by a lot of insurances. I mean, you have to obviously say the things like leg pain and so on and so forth. You have to experience them, right, for you to actually come into the physician. But if you do, you have to do an ultrasound, because like you said, actually, you're one of the lucky ones that has an ultrasound in-house that can check for a DVT. But DVTs can also be silent, right?
Absolutely.
I mean, they don't have to lead to a severe leg swelling and all these other things. You might be experiencing other things that cause leg pain. So you have to have a thorough evaluation. But thankfully, at least that one aspect of healthcare, majority of insurances, if not all, cover at least a screening duplex.
Yeah, the diagnostics.
And
for our friends that are watching that are at primary care, FMPs, PAs, this is a helpful thing for them because they're busy doing other stuff. And they're like, gosh, if I could just do this for it's just a couple extra ICD codes, right on there, learn what they are, learn what to look up. And you can be really helpful with something that you're trying to manage in another way that is frustrating to you because you're unable to help. And now you can, because this is an opportunity to try to do that. I have a question regarding a patient like me with a history. So when I was younger, is it possible that my DVT that I received when I was 25 years ago was the starting point to my disease?
That's interesting, actually. Yes, it could be, because there are always multiple risk factors, right? When you're 25, I mean, you played sports and these other things. So sometimes that trauma itself can lead to venous disease, especially when you don't have a lot of compression stocking usage and you have a history, a family history or something like that. Those could be factors. But a DVT itself, because it limits the flow when the DVT was present, I mean, yours is gone. Yours is, thankfully, it's not a chronic DVT, tends to limit flow through the main vessels over time, right? So that blood has to go back up to your heart in some way. Then your superficial system, which is the venous system that we're looking at, that we treat for venous disease, may be overtaking or maybe taking on some of that burden, and therefore it's handling more of the traffic than it's capable of. It's kind of like using Waze, right? The highway is blocked, so now you have a whole bunch of vehicles going through these, alleys
detours.
and gosh knows what. But then those roads get blocked, right? Because everybody's going through that same way, trying to get back to their destination. And so that's similar to how your body works, and that could be very much an inciting event as to the origins of your venous disease. But then there are it's a multifactorial thing, so that could be absolutely one, but it's hard to state that that's the only way, because if I followed you through the years, if you're a part of a study and I said, hey, she's got a DVT, let's follow her along and double blind it to a patient that doesn't have vein disease, no history of it, to somebody else that has other factors, then we can say, okay, the DVT in this specific patient did lead to the venous disease. But that is absolutely one of the factors.
Okay, everybody, a shout out to my favorite product ever. It's called Lucinergy from New BioAge. Why I like it is because it has resveratrol in it, B6, and something called leucine, a low enough dose to mimic exercise. I take 2 in the morning, I take 2 in the afternoon, and it hits all those longevity pathways. It helps push your natural NAD+. And I know you've all heard about this, so stop taking NAD directly. You want to incentivize your NAD so it goes down the right pathway so you can live long, healthy, and strong. Thanks, New BioAge. Now I know I love how when we talked about it, it's a valve, and you actually have a great demo you show in the office where the valve opens and the blood goes through, and some valves get stuck, and then the blood pools down there, and people's vascularity accommodates the way it should, and they get bulging veins and things like that, or just painful legs, or they start breaking off into these other type of spider veins, right?
Yes.
That's why
branches of branches.
Yes. Having children can be a risk factor.
Absolutely.
Right?
Yeah.
Multiple children.
Even worse. I mean, it compounds, right? Because when you have children during your pregnancy, your body volume almost doubles. And so every woman who's in pregnancy, late parts of the pregnancy, I can't imagine that it's less than 95% that they have venous reflux. But a lot of people, it is temporary, right? Once you deliver, you lose all of this extra liquid in your body, you tend to recover from a lot of this. But if you have a family history of all this, you have other factors influencing it. That sometimes it's sort of like that straw that breaks the camel's back, and you've got permanent damage of your valves, and then it progresses. If you don't treat it between pregnancies, it progresses pregnancy to pregnancy, and so whatever percentage risk you had at the initial pregnancy, you double that, triple that, quadruple that, depending on the number of children you have. So the only way to fix it is to fix it early. And, hopefully you resolve a lot of the symptoms and make sure it doesn't progress to later stages of vein disease.
When you're younger, like you mentioned, athletes, younger people, is it beneficial for them to wear compression stockings when they're doing long runs or when they're lifting weights? Is that actually help?
Yeah,
prevent the disease?
It's one of those things, right? Where you obviously have mechanisms in your body to help you, which is basically the main thing in the body that helps venous disease is called the calf pump, which is your calf muscle. But there's always benefit. There's always a big benefit for external compression, if nothing else, to help keep the edema and things like that almost everybody has by the end of the day, because simply that's just how gravity works. So compression stocking usage, I'm a big believer in it. Especially when you travel and you have all these pressure changes when you're in the airplane and so on. Even if they pressurize, it's never the same as being on the ground. So I would highly recommend anyone that is very, very active or even inactive to wear compression stockings when possible. And we live in Southern California.
Yes.
So it's not real or realistic to expect everybody walking around with these wonderfully beautiful compression stockings that are knee high.
But it's so much more acceptable.
Yes, it is, of
it
course,
really
now.
Is.
Yeah.
It is something that's become, I just got back from the longevity festival and several socks in my bag that was given to me, compression socks. So it is, and I did Ironmans and all those things back in the day.
Yeah.
And even then, that was becoming the buzz to wear these compression stockings. Now it was for athletic ability, right? They were looking at it more as an edge.
Yeah.
But now looking back, they know how important it is for our overall
Absolutely,
vascularity.
overall health in general. Yeah, it gives you an edge to help decrease, post-procedure fatigue even, right? Or not post-procedure, post-workout fatigue and these things. And now we realize maybe there are more benefits than what we initially thought.
How important, I know this answer, but I want you to share why.
Yeah.
Is wearing your compression stockings after you have a sclerotherapy procedure.
So it's funny because we recommend compression stockings, of course, all the time, but it's very important after procedures. The ablations that we talked about earlier, it helps you to decrease symptoms. But after sclerotherapy, which is what we use to treat the outside veins, whether they're bulging or small or cosmetic, it's important for the actual procedure. Because that medication that we give to you, we want it to remain in the veins as much as possible. And it's not like the Instagram videos where you inject the veins and magically they go away. There's a reason why the video stops right there, because the veins fill back up. But what you want is the veins to fill back up with a little bit less blood than they usually carry. So when these veins shut down, any of the trapped blood, you're decreasing in volume. Because once the veins close in your body uses its own cells to absorb those veins. So you're trying to make it easier for your body to have reduced amount of vein that it has to absorb, thereby giving you the cosmetic outlook or decreasing symptoms post-procedure faster.
Totally.
So yes.
Totally. He explained it perfectly. Now, we're going to talk about the procedure I had, and that was using a laser. And did you also use heat on me? Or just
yes, the laser. So
the radio
frequency, there's laser. I kind of say laser for everybody because I want to make sure that I'm not getting into the weeds too much and confusing the patients.
Right.
But
because he'll decide when you go see him what procedure he wants to do on you. But this kind of opens their eye up to the advancements.
Yes. And the interesting thing is now we have various methods that we can use to close veins. I mean, I'll speak to you about the ones that I like, but also the ones that exist out there. So the ones I prefer are the sort of the old ways because I think they're the tried and true, and we've got a very good outcome-based experience. So I use either radiofrequency ablation or laser ablation. The difference is the type of fiber we use for both of them. However, the concept of using heat to close the vein is the same for both of them. Excuse me. However, the other methods that exist is a glue called VenaSeal. So you inject the glue into the vein, put pressure on top of the vein, you basically super glue it shut. There's another one called Varithena, which is a foam, which is actually similar in medication to the ones that you use for the outside veins, but this one is mixed with nitrogen, thereby making it a little bit thicker than using room air. Then there's another procedure called Claravane, and that one's interesting. It basically creates trauma in your vein by rotating this metal, a sort of a flange, and then it injects medicine as it's pulling out so that it basically closes off the vein as you are pulling that out. But, positives and negatives put together. I've used most of these except for Claravane. I would say the heat-based ablation, in my opinion, is the better way to go. A lot of people claim VenaSeal is a bit better because it doesn't use anesthesia, but I've used VenaSeal, I've used a lot of these other procedures, and I just feel that the initial main veins are best served by laser or radiofrequency ablation, in my opinion.
Well, I had the radiofrequency ablation, and to be perfectly honest with you, it was just a quick smart. It doesn't even it doesn't hurt. Like, it's not like you're screaming. It's nothing like that. And when it's over, it's over.
Yeah.
And you can see with the ultrasound if you ablated the vein or not.
Absolutely.
Right?
Yeah.
You're either 100% or you're not.
Yeah.
And I love that about it.
Yeah.
Now, putting that IV in is another story in the back of my leg. That was fun.
Yeah.
But it is not that difficult to do. And the great part is you told me literally, go work out.
Yeah.
Keep your body moving. I had zero signs. I only wore my compression stockings till the next day. And then I decided, let me see how I feel. I just kind of wanted to see how I feel.
You don't want to tell me that.
I know. After I asked you that important question, do not do what I did.
Yeah.
So because I went and worked out, and I
Right.
thought, let's see if I get puffy down there in the,
Yeah.
the big, I kind of want to see the elephant foot.
Right.
Did not happen to me.
Yeah.
And I was pleasantly surprised. Now, interesting enough, which I suspected what would happen, was now that I'm about 5-6 weeks out,
Yeah.
I'm having a little bit of that rope feeling.
Yep.
That little tug in the back of my leg, like, ooh. Now, again, I don't need Advil or anything
Yeah.
for it, but it's present.
Absolutely.
And it makes me so glad I did it because I was having more pain than that ever could be.
Yeah.
And that is what, doctor? That's my body's way of
Yeah,
breaking
when
down
we close
everything?
the vein, right, it is, I try to use the analogy of a rubber band. So when the rubber band is nice and loose, it just it sits there, and the rubber band is attached, like your vein doesn't just hang like a rope. It's attached to the surrounding tissue. Once you ablate the vein is closed. So the vein pulls down as it's shrinking, and that's what you're feeling. So it does improve. All of these things are temporary, unlike venous disease that's not treated. So this will get better. Your body will absorb it. And remember that once you are ablated, unless you have that small percentage of patients that fail the initial ablation, ablation's forever. So this is not something you have to go through again. And I don't like to oversell the party and say this is a complete pain-free process. Of course, there's going to be some needle pokes and things like that. But again, one-time thing.
It's pretty simple. You don't need anything for it.
Absolutely. And 99% of my patients don't even take Advil or anything like that before they come in. I think sometimes our biggest enemy is our mind, right? Before you undergo the first time, you just don't know what's going to happen.
You don't know what's going to happen.
Yeah.
I had a little bit of anxiety, and I was like, oh gosh, I don't know why I'm feeling, because I didn't know.
Yeah.
I didn't know what I was in for, and I would every minute that went by, I was like, oh. I was relaxing more and more. And it was not, I don't want people to think it's a big deal. It is not a big deal. And the beauty of it is that you've got him there doing the ultrasound at the same time, identifying where he's located, and then he's verifying that this is done.
Yep.
And then you come back, you have to have your follow-up, and then he just makes sure he doesn't see anything abnormal, any pulling of any blood vessels anywhere, right?
Yep.
Any like little blood clots or anything, and then you're free to go until you have to come back for another one, which is what I have to do. So so I'm going to be doing mine again, and I may bring the camera in on that one, and we may video it because I think it'll help people see and feel more comfortable with it, because I know people that are actually afraid to do things like this, and I don't blame them. But you're going to feel so good after you do it. And then what he's going to do is he's going to do all my little tiny veins that I have around the back of my knee that are, I don't see them, so they don't bug me, but they're there. Yep. And I know they'll look better once you get rid of them, but that's the icing on the cake. He's not going to do that till he does the other stuff. Yeah. Right?
Absolutely. But we will take care of it.
But
Absolutely.
he will take care of it.
We will take care of it.
So I know there's more. I know I had a couple extra questions here that I wanted to. Why don't you tell us exactly where they can find you online and on Instagram?
Yep. So our practice in Newport is called Coastal Vein Care. It's pretty, I think, easy to understand that we do veins. We are on the corner of Avocado and Coast Highway. It's a pretty interesting building, actually. I think it's got a history behind one of the famous architects in Newport.
Yeah.
So I love the
Super
location.
cool.
Yeah, it's easy to find us. And one of the big things I always like to tell people, yes, after the ablations, you do have to go walking or work out, and there's no better place than Fashion Island, right?
That's right.
And they just keep expanding with more stores. So you can get 30 minutes in no time. I almost, I always joke saying I need to get some kind of a deal from the place, because I send so many customers out to Fashion Island, but we'll see. That's in works. But you just have to remember that everything is done in office. There are no question marks as to what we're doing. Everything is done under ultrasound guidance. Everything from the placement of the needle to the IV to the ablation to the injection of anesthesia. There is no guesswork. Until the procedures are done, and then you go and get out. Every single thing is precise and planned. So, and also, like we did with the COVID testing, I like to have everything in-house. So I don't send you out anywhere to do any part of the treatment or testing for the treatment. We do everything in-house. So
Yep.
we try to make it
Including
as
he
simple.
gives you your cell phone.
And that's the big thing is my patients should never have a difficulty getting in touch with me. So I give the same cell phone my wife has. Maybe I should give hers, but I have the same cell phone number that my wife has that I give to, that I give to my patients. So I really try to follow up with them. I have patients text me. It doesn't matter whether I'm in California or Croatia. I will be able to answer your text messages. And I do have young children, which means that my sleep schedule has been terrible for years, which means I should answer your text messages.
We were actually texting like at 4:30 in the morning one morning because we're both crazy.
Yes.
But you're raising little ones. So listen, girls, he's taken, super happily married, got a rock star wife. Look at her helping him with she's even trying to pawn the phone off of her.
Yeah.
And little children.
Yeah.
So
Indeed.
he's your vein guy, though. He could
Yeah.
be your vein guy and take care of any type
Yes,
of
that would be my pleasure.
the foregut
Forget
surgery.
stuff. Hopefully not at the same time.
Hopefully not
Hopefully
at the same
not
time.
the patient for the same things. But yeah.
Okay, quick thing. Who is not a candidate for something like this?
Yeah, I mean, probably somebody with an active infection. With in the legs, you want to treat that first. It's the people that are inclusive are not as many as people that are excluded from this. I would say pregnant. You really don't want to. You just want to, no matter what stage of pregnancy, and if you're planning and actively, maybe IVF treatments and so on, this may be completely fine, but you just don't want to take a chance. And sclerotherapy is kind of contraindicated during breastfeeding. And we could definitely do ablations during breastfeeding. You just have to pump and dump until the lidocaine is out of your system. Usually about 3 to 4 times of pumping and dumping. But otherwise, there are really not many contraindications. That's the one nice thing about this. In fact, we don't actually stop any medications when we do these procedures. Some people are on blood thinners. Doesn't matter. We keep them on the blood thinners while we do this procedure. Because it's an IV, and what could possibly bleed? The vein that we are accessing is the vein that we're closing. So the bleeding is really not present. And the risk factors are very few. In fact, you are helping a lot of things with the bleeding when you have active issues like lymphedema, history of blood clots, and so on. You really want to decrease the reasons behind them. So those that are not candidates, I would say, are the ones that have active infection or are pregnant, which really are a very, very small percentage of people that see us. And we just hold off, and then they come back.
The beautiful part about what you do is you really do help people with that kind of longevity feeling factor where people are living with chronic pain. And pain is, I feel like it's the one thing that kills us when we're old. Our body aches. Yeah. It's not just our joints. It's our vascular system. Yeah. And it hurts to get up and move. And we get dizzy. I mean, there's a lot of stuff that falls into the aging. And if we can leverage ourselves and kind of know our body and see what we're in for, and see what we can do for it, I think we'll live a lot, at least a little more pain-free than we are now.
The quantity of life is something that we talk about in longevity, but really the quality is what matters, right? And so, yes, we've made amazing advances in medicine, but the debate always is, where is it that you're trying to go? Because we can keep people alive for a very long time, right? This is an ethical as well as a medical discussion that we tend to have often, especially when I was doing trauma surgery. You tend to keep these people going, but then you ask, are we keeping these people going for the people or for the family? Right. Or for our own desire to not feel like we've lost a battle with a patient, right? So, yes, vein disease is something that's going to be very helpful to treat.
Piece of the puzzle.
A piece of the puzzle, but there are a lot of things, right? At the end of the day, longevity, majority of the time, comes down to diet and exercise and taking care of yourself. All these things are in addition to that. But I don't want to ever make people think I do all of this and the rest will fall into place. You have to have the main parts of taking care of yourself first.
Pieces of the puzzle.
Yeah, and then we can absolutely help you decrease some of these symptoms from the venous disease and hopefully have you get a quality of life, not just quantity.
Absolutely. That's why my dad, who had major heart attack, he has heart failure, heart disease. He has neuropathy, but I think a lot of that's probably vascular and possibly could be helped.
Yeah.
So we're going to send him down your way
Sure.
and see if he can't get some relief,
Yeah.
Quality.
Absolutely, quality. Yeah, and
Quality.
we have patients that are 90 plus.
I love it.
Right, and we have patients. I mean, we have patients as young as 18. The only reason we don't have younger patients is because we don't see pediatric cases. But why do people ask? Why are you treating people over 90? Some of these people have ulcers, but they still have a lot of life left in them.
Yeah.
Right. And my goal isn't to just say, oh, they're 90, let them, do whatever at the end. It's about making sure even their last years are pain-free or quality. So we've got, I would say, a couple dozen of 90-plus-year-old patients that have wonderful lives. They have grandchildren, great-grandchildren that they love and hanging out with. And the only thing preventing them is venous disease and the pain that they're getting from possibly open ulcers or significant varicosities or fear of them bleeding because there's a very thin level of skin between the vein and environment. So my goal is not to not even discriminate, but have a dichotomous relationship with this where I say, oh, you're old enough or you should just live with this, because we want to give quality of life to patients, whether they're 18 or 85.
Yep. Individualized care.
Individualized care.
And we're all headed back to that. We're trying to do that.
Yeah.
Providers have limited time, especially in the system.
Yeah.
And, I see the pendulum swinging a bit. It's going to have to.
Yeah.
So I love that you're part of the piece of the puzzle for people at any age, and it does not discriminate.
No, it doesn't. And that's one of the big things I always say. It's unfortunate that our healthcare requires volume of patients for it to be viable, but hopefully when they come to me, they understand that we're not trying to rush things, and we always take our time, at least in some aspect of their healthcare. They can have a respite from the craziness of all their other care from other providers. So
yes, living pain-free is the goal for people I love, circled around me. And who would have thought, this is like considered a cosmetic. People think of it cosmetically, don't they?
Absolutely.
But it's so much deeper than that. That's why I wanted to bring it to the forefront, make it a little fun.
Yeah.
Make it, it has its beautiful parts to it too. It's nice to see those veins shrink and the blue go away on your legs. I mean, nobody wants to see that. But I appreciate you for spending time with me. I appreciate you for being my doctor and treating me with the care and compassion that you and your staff do.
Yes.
Because that's a lost art. And thank you for doing that. And thank you for being on the Beauty Outlaw today.
Thank you, Jerry. It was a pleasure.
And before we finish, now I don't know if he drinks, but he does toast. So we always toast.
I'm a surgeon, Jerry. I drink.
I wasn't going to say anything.
You can't go through life as a surgeon without some drinking.
Okay. So again, thank you for all those things, and thank you for being on the podcast today.
Cheers.
And we'll see you on the next episode of The Beauty Outlaw.
Thank you.